Hello, everyone. It's our great pleasure to present during the Palmer Symposium. My name is Annie Thomas, and I'm a faculty at Marcel and Nyhoff School of Nursing at Loyola University, Chicago.
And my name is Carolyn Toth, and I'm an FNP student in my final semester at Loyola.
Our topic of today's presentation is evidence-based interventions to promote sleep health. Carolyn initiated this important task of reviewing the sleep health intervention as a part of the comprehensive exam paper during the Master of Nursing program. So I welcome Carolyn to begin presenting this important topic on sleep health.
Thank you. Dr. Annie Thomas was my comps advisor, and she encouraged me to submit my literature review to the Palmer Symposium. So we'll start with the background and significance, which is that insufficient sleep and sleep disorders are prevalent in the United States and are associated with significant morbidity and mortality. Insomnia is the most common disorder that causes insufficient sleep in the US and is also one of the top complaints reported in primary care. There is a clear relationship between short sleep duration, poor health outcomes, and mortality risk. Sleep loss also negatively impacts the components of the immune system critical to host resistance to infection, which is especially relevant during a pandemic. The purpose of the review was to help close the gap between current evidence-based guidelines and the current clinical practice for treating insomnia. A literature search was conducted using the search terms insomnia and evidence-based interventions on the databases CINAHL, PubMed, and Scopus. The search was restricted to 2015 to 2020 human subjects in English language. After the literature search, 40 articles were retrieved and reviewed, and 29 yielded results to support the purpose. Insomnia has been traditionally treated with pharmacological agents long-term, but the evidence overwhelmingly shows that this is unsafe and ineffective. Cognitive behavioral therapy for insomnia has consistent evidence of effectiveness and strong evidence across multiple sleep outcomes. Clinical practice guidelines published in the United States, Canada, and Europe unanimously recommend cognitive behavioral therapy as the first-line treatment for chronic insomnia. In addition to effectively improving the symptoms of insomnia, cognitive behavioral therapy has longer-lasting benefits and fewer adverse effects than pharmacologic therapy. Despite extensive evidence on the benefits of cognitive behavioral therapy, few patients are treated with it. The key barrier preventing widespread access is the lack of trained clinicians. The Venn diagram in the bottom left lays out the components of cognitive behavioral therapy for insomnia. As we were synthesizing the evidence, we found that clinicians need to modify their practice to close the gap between current clinical guidelines for evaluating and treating insomnia and current clinical practice. Providers can aid in reducing the ubiquity, economic burden, and health disparities associated with insomnia. Evidence-based interventions with strong evidence across multiple sleep outcomes include cognitive behavioral therapy, digital cognitive behavioral therapy, and brief behavioral interventions, and should be utilized as first-line treatment. Pharmacologic therapy should only be used short-term and in conjunction with a non-pharmacological treatment option. Based on this information, the chart in the middle of the poster lays out the clinical algorithm for treating insomnia in primary care. So now we'll move on to the implications for practice, which is that we found that discussing sleep with every patient at every visit can reduce the incidence of a wide spectrum of morbidities. Additionally, educating patients on the importance of sleep and to overall health can help improve outcomes. Primary care providers can help shift the paradigm surrounding medication usage for insomnia. Because benzodiazepines do not have evidence backing their use in treating insomnia, primary care providers can deprescribe them while starting more effective treatment options, such as cognitive behavioral therapy. The guidelines for deprescribing these drugs are listed in the chart in the bottom middle of the poster. A systematic review that explored the comparative safety and efficacy of pharmacological treatment found that short courses of less than 4 weeks of melatonin, Ramelteon, Zolpidem, Suvorexant, or Doxepin are the most safe and effective across multiple sleep outcomes. Cognitive behavioral therapy or digital cognitive behavioral therapy should always be used as first-line treatment when possible. In March of 2020, Somryst became the first prescription cognitive behavioral therapy to treat, or digital cognitive behavioral therapy to treat adults with chronic insomnia approved by the FDA. This has the potential to resolve barriers that have presented widespread utilization of cognitive behavioral therapy in treating insomnia, including the lack of trained providers and higher costs. I included some images of the Somryst interface and techniques that can help stop the cycle of insomnia. If primary care providers base treatment plans on these current evidence-based guidelines, they can help decrease the public health burden of insomnia. Thank you for listening. I hope you enjoyed it, and please reach out to us if you have any questions.